This conference will now be recorded.
Okay, so we will continue with the same in continuation with the yesterday's lecture. That is Kushtha Nidana with Chikitsa Sutra. Now, yesterday we have seen about the introduction of Kushtha Nidana, and later on we have discussed about the Purva Rupa, Rupa, Samprapti, Sapta Dravya Sangraha, then types of Kushtha. Those all things we have already discussed yesterday, and today we will start about the next things, that is Dhatu Gata Kushtha symptoms. Now, what are the Dhatu Gata Kushtha symptoms that are only described by the Charaka Samhita, Sushruta Samhita? It is not at all described by other texts. So, this is a contribution of Sushrutacharya. We must have to agree. Now, Sushrutacharya has described that he has given example of seed inside ground. Like the seed grows step by step, the skin disease also grow step by step or progress step by step. In skin first, it shows the symptoms, and then it goes to the rasa, the mamsa, like. Okay. So that's why, accordingly, we will go through it. Next, Upadrava. Now, Upadrava should be as like complications. So, Upadrava, that due to Kushtha or the skin disease, what next disease or the condition takes place. So, only Charakacharya has explained about the Upadrava. Not Sushruta have explained about it. Charakacharya himself explained that if it is curable but not treated in time, then Tvak, Mansa, Rakta, Lasika, and Kleda exudation happens, and Svedajakrami are formed at that place, and the more vitiation of Vata the dosha take place, and thus the Upadrava appears. Now, those again Upadrava also explain according to the dosha dominance. Mainly, these complications are described as follows: secretion of pus, severe pain in the body part, distortion of body parts, that Galita Anga, Trishna, Jvara, Atisara, Daha, Daurbalya, Arochaka, Avipaka. Now, distortion of body part means, suppose the skin disease is at the finger, so that finger is lost, like in leprosy. Trishna, we know thirstiness, Jvara, fever, Atisar, diarrhea, Daha, burning sensation, Daurbalya, general debility, Arochaka can be explained as anorexia, and Avipaka, that is indigestion. Now, coming to the treatment guidelines. So, this is the general line of treatment is described here in Chikitsa Sthana 7th chapter. Sarvam tridoshajam kushtham doshanam tu balabalam yatha sway lakshanaihi budva kushtanam tu kriyate kriya doshasya yasya pashet kushteshu visheshalingam tasyeva shamam kuryat tataha param cha anubandhasya. Means again here the vitiation of three doshas are there, it is true, but for samanya chikitsa or the first line of treatment, we have to observe carefully the signs and symptoms clinically, and then we have to decide the line of treatment. Line of treatment definitely will be according to the predominant dosha. That means if the pitta is more vitiated, we have to address pitta first. That is, the viration will be the first line of treatment there, and thereafter the remaining doshas will be addressed. Now see, Charak has clearly emphasized in general line of treatment, not only about Kushtha or the skin disease. He have uh, given us the line of treatment or a clear sutra which is applicable to everywhere. That is in Viman Sthana 7th chapter. Samshodhanam samshamanam nidanasya cha varjanam etavad bhishaja karyam roge roge yathavidhi. That means samshodhan first. That means Panchakarma, biopurification. Samshamana, that is the palliative therapy or pacification, Shamana Chikitsa. And the third one should be Nidana Parivarjan. So this should be the protocol or standard protocol about every disease as per Ayurveda. And not only for Kushtha. So Samshodhana is must. And we know the importance of Samshodhanam. Etu Samshodhanaihi siddha na tesham punarudbhavaha. So Ayurveda samul rogacha nash karto. We say like in Marathi. When it is possible, if it is treated in this manner. Samshodhan first, then Samshaman and Nidana Parivarjan. Now this Nidana Parivarjan, that means the causative factors should be avoided lifelong. If the causative factors will be again consumed or followed, then the disease relapse is sure. So Ayurveda never says that once you do Vaman and you will never suffer from kapha diseases. It is not like that. Okay, so we have to educate our patient society accordingly, because the Ayurveda is treated sometimes like a magical treatment. So it should not be like that. It's a science and it should be followed like a science by all, by doctors, Ayurveda doctors, as well as patients, as well as society. Now, Sushruta has specially, I have said before that Sushrutacharya had dedicated 2 chapters for Chikitsa Sthana, Chikitsa of skin diseases. And himself, he described that the treatment in Purva Rupa Avastha and Rupa Avastha also he had explained. So premonitory stage, Sushrutacharya is the only one person or scholar of Ayurveda who have described that the premonitory stage Samshodhan, that is purificatory therapies, should be administered. If the skin disease is at the upper part of the body, then Vaman, that is emesis. And if it has the downward part of the body, then purgation. So dosha dominance is there, as well as where the disease is located. The nearest way we should administer the dosha haran process, either Vaman or Viraj. This is the speciality of Sushruta, that in Purvarupa Avastha he have advised or prescribed Panchakarma. Then Vagbhatacharya also explained premonitory stage Snehapana according to dosha dominance. And after, according to dosha dominant and its location, this Samshodhana or elimination therapies should be administered. Now here is the Vagbhata is not followed or compiled only Charaka and Sushruta together, but himself he have given some important things also, such like Snehapana. Okay, that the shaman like treatment he have advocated first. Definitely, if the doshas are not vitiated more much, then it is possible to cure with only Snehapana, the Siddha Sneha according to dosha vitiation. Now we'll see about the Samshodhana Karma first. So, eliminative therapies. First of all, we will discuss. Vatottoreshu sarpihi, vamanam sleshmottoreshu kustheshu, pittottoreshu moksho, raktasya virechanam chagre. Just like if the vata dominance is there, then cow ghee internally. So plain cow ghee or medicated cow ghee, that the recipes are prescribed many more in Charaka Samhita. If the kapha dominance is there, then Vaman, that is a medicated emesis. Then Pitta, that is virechan, herb induced purgation, and Rakta mokshan, that is the bloodletting. If the disease is at the small part or small area of the body, then we'll go for the Sthanika Rakta mokshan like Chalavkavchara. Or if the disease is spread more much all over the body, then we have to do Sarvadehi Rakta mokshan. Now we'll go for after that Vaman first. Charak, Sushrut, Vagbhat, all are included Vaman. as an indication for skin disease. Then Virecha is dominated, if Pitta dominated, then Virecha, and after it should be followed by Raktamoksha. Raktamoksha, especially by Kurcha, that is brush, by brush. Then Shringa, Alahu, and Jalovka. This local method is described here. Now, about Rakta Mokshana, it is clearly mentioned that you should not apply anything like lepa externally on the body or externally from the body until and unless the patient has undergone through Rakta Mokshana, whether it is Sarvadehi or Dhanic. First, Rakta Mokshan should be there, and then after that, one should go for lepa or external application in the skin disease. Many times in your OPD, patient do come with the skin disease, and in the first line of treatment, they do ask you for external application. Sir or doctor, please give me something prescription for external application. So you should educate or you should guide them that we will do first Shodhan, and then you have to apply externally, and then there will be useful. Like utility or proper line of treatment. Okay, so you should go for it. Now Anuvasan in excess vata, and after that purgation, you should go for asthapan. So if vata visheshan is more, Anuvasan first. Now if you will go, if suppose kapha dominant skin disease is there, you must know that Kushtha with kapha vitiation or kapha dominance, that the clay that is there, you should not start with the Anuvasa. You should go for their Niruha. Niruha Basti does Madhyama Shodhan only, which is not enough to eliminate dosha in Kushtha. But Basti can be given if the Kushtha is Vata Pradhan, Rukshata is more and less Kleda. Then you should go for Anuvasan and Niruha. Okay, Nasya. We may say, what is the role of Nasya? That is the inhalation therapy, especially the skin disease which is caused by Krimi Kustra or Krimi. Then only, if the kapha dominance is there, then Saindhav, Danti, Marich, etc., these Nasya dravyas are prescribed. So accordingly, suppose the skin disease is in the head, many times it is there, or on the face, then you should go for Nasya. Because Urvajatru Vikareshu Nasyam Prashasyate means above collarbone, if the diseases are there, then Nasya should be there. You can use Shodhana Nasya, you can use Shaman Nasya, and accordingly you should go. Sharandaracharya also listed Kushtha in the Virechana type of Nasya. This is important thing which I have just said. Next is Dhumapana, smoking therapy or smoke therapy. So Vairechaniya type of dhuma are described in Sutra Sthana for skin disease. As well, the drugs or the herbs like Shweta, then Jyotishmati, Hartala, then Manashila, Agaru, those cures the Krimi, Kushtha and Kilasa at the head site. It is described. Again, see, Dhumapana is again a inhalation of dhuma. Okay, so especially here, Hartal and Manashila, these are the poisonous minerals or the thing one should take care. Instead of that, we should go for the such herbs like Shweta, Jyotishmati, etc. Agaru. Now, Bahi Parimarjan Chikitsa. Now, see the first elimination therapy, that is Panchakarma, is advised. And then Bahi Parimarjan Chikitsa means external applications are advised or listed here. First, Vagbata has prescribed purification. After purification, only the internal medicines and the Parimarjan Chikitsa should be given. If Tikshna or strong lepa is done without Shodhana, then what will happen? The disease condition will be worse. Okay, so it will be like Vaidyakrita Vyapat, and we are not supposed to do that. Then the next in Parimarjan Chikitsa, application of Kshara, Lepa, Snana, Udvartana, and external application of medicated oil are also. Now, Kshara, we have to treat it as alkalis. Lepa as a pack or ointment. Snana is a medicated bath. Udvartana, you know, that is the powder. So, medicated powder which are prescribed for specially skin disease should be applied. And external application of oil like Katutuvarak tel or Nimba tel can be advised according to the vitiation of doshas. Now see here, which we have discussed, that Sushruta has speciality that he has described that stage-wise administration of Panchakarma, Dhatugata Kushtha. So you can see here in premonitory science, he has advised Vaman and Viraj, Lepa not advised, Raktamokshan not advised. Then next, when the disease is localized in the skin, that is the Rasa Dhatu, then purificatory, that is Vaman and Virachan is advised along with Lepa. Then if the skin disease go more deeper, Gambhira, that is Rakta Dhatu, then Vaman Virachan, Lepa, Rakta Mokshan, and Kashayapan, that is drinking of decoction, such like Khadira Kashaya, plain, or Manjisthadi Kashaya. Okay? Then if it is go more deep, that is Mansa Dhatu, then Vaman Virachan, Lepa, Rakta Mokshan, Kashayapan, along with Arishta, Mantha, Prasha, that is available. So that is the internal medication. After that, he specially mentioned if it goes to further deeper, that is Meda and other Dhatu, it becomes Yapyan. And in this stage, he has just prescribed about the Vaman Virachan and Lepa. So you should give idea that it is now Yapyan. You should go continue with the treatment. If you will stop the treatment, then the disease will be worse. Okay, so you should not guarantee to cure it completely. And internal medications are also strong, such like Bhallatak, Shilajatu, Dhatu Makshika, then Gukulu, Agaru. Okay, so Khadira, Asana, Ayaskriti, etc. So these are the, in the fifth stage, he has completely described that incurable stage, Asadhya. Okay, so this is the Sushruta specialty. So even though now we are studying about Charaka Samhita Purvartha, Kushtha Nidana, we should know the contribution of other scholars also. Okay, we'll go for the Samshamana Chikitsa. So internal medication is here. Even Charak has prescribed Kushtagna Dashimanigana, that the 10 herbs are described which are anti-skin disease property. So you should use it for. Now, how to use that we have already discussed. You can use as a bath, you can use as a pack, you can use as a internal medication also. Then Sushrutacharya has explained two gana, that is the groups, Aragvadhadigana and Lakshadhigana. After that, Vagbhatacharya also explained the Kushtagna gana, Aragvadhadigana, and one more Arakadigana. Now, rasa, which taste that person should go? We should say that we have seen the positive factors, that the lavana and the amla rasa are the positive factors for the skin disease. Now, what about to cure the skin disease? So, Charakacharya has mentioned the bitter, that is the tikta rasa and kashaya rasa. These both tests are useful. So, you should recommend the patient that you should prefer bitter and astringent taste in your food. Okay. After that, Sushruta. Now, what Sushruta has not specifically discussed about the test. By authority, I can say, because I have gone through all the seven, Brihatrayi and Laghutrayi, all seven granthas. Then Vagbhatacharya has Tikta, he has mentioned like Charaka, but he had added Panjan, that is the chili or Katu rasa. Then about Kashaya now, Charakacharya has given numerous recipes for Kashaya, that is the decoction. Sushrutacharya has explained Kashaya specifically, we have seen just before first previous slide, that if the disease is in Rakta and Mausdhatu, then Sushrutacharya has prescribed Kashaya. Vagbhatacharya, Sarangaracharya, and Bhava Prakash Maharshi have explained more varieties about the decoction, like the Bhava Prakash has mentioned about the different kathas. Now about Churna Yoga, that is different combinations of powders. Charakacharya has even enumerate again listed many recipes for all types of Kushtha. As well, the other text also describe various tissue, various recipes. Now, Asavarishta, Charaka has explained Asavarishta also. That is Asavarishta nothing but the fermented effusions or decoctions, or we can say self-generated alcohols. Sushruta and Sharangara are also given many recipes. I have not listed the names because we have here studying about mainly in Purvat. Now, Abhyantara Taila Prayoga are also there. That Charakacharya has mentioned that some recipes of Abhyantara Taila means Siddha Taila you have to use for shaman, for drinking, for by mouth. Then Sushrutacharya has explained very few recipes, especially for Vataj and Kaphas disorder, for vitiation, skin disease. Bhav Prakash mentioned Mahapinda Taila for skin disease. Now, this is not external application, friends. This is for Abhyantara Taila Prayog. No one is using Mahapinda Taila for skin disease. So we have to choose such things and we have to practice accordingly. Abhyantara Ghrita Prayog is also there as a Snehapan, Purvakarma for Panchakarma or palliation therapy also. Medicated ghee, especially for the Pitta vitiation, Rakta Pitta vitiation and Vata Pitta vitiation. Means wherever there is Pitta dominance, then ghee is prescribed there. Next is Ashtanga Sangraha. Repeated sum of Charaka and Sushruta as it is, and Ashtanga Hridaya has followed the previous scholars but added some unique recipes such as ghee medicated with Cassia fistula root, means Aragvadha Moola. Okay. Now the Yava Prayog is also described. Yava is a Kshudra Dhanya. We know it. That is, it is the mainly Kleda Nirhana or Kleda, we can say, reducing Dravya, Ahariya Dravya also. So Charakacharya has used it in Prameha Chikitsa, and the recipe is used like roasted Yava, dry sattu, mudga, and amalaki. But will not suffer from the Kapaja Kushta. Means it is specially recommended. The formula is recommended or prescribed in Prameha Chikitsa, but it is useful to treat Kapaja Kushta. Okay. So Sushrutacharya again has explained some Gruel, Mantha from Yava. Then Vagbata has explained Kushtagna property of Yava. Again, the tablets, which are the most recommended form for any disease. Charakacharya has definitely prescribed about the two tablets, Manduru Vatak and Shila Jadu Vatak. Vagbadacharya has explained about the tablets like Manibhadra Vatak, Mandur Vatak. Sarangaracharya and Bhavprakash has explained about the many types of tablets for it. Now, Gugulu Prayog. Charakacharya has explained about the Yogaraj Gugul. Now, he has not explained that Yogaraj Gugul how to use. But definitely, in Vataj variety of Kushtha type, this Yogaraj Gugul will be more useful. Then Panchatikta Gugul, Gugulu Yoga, Kaishwar Gugul, Kanchanar Gugul, Mahayogaraj Gugul, Amritadi Gugul, Sihanath Gugul. These are also some recipes which are prescribing subsequent text or the scholars of Ayurveda, and they have having Kushtagna property, it is mentioned. So you can see when we discuss about the Kushtha, we have only some recipes to treat it. Like Gandhak Rasayan, Arogyavardhini, Kadunimba or Panchanimba Churna, that's all. Laghumanjishtadi Kasha. And here we end our treatment protocol, or the list of those medicines is finished. Now with this lecture, you can know that we have multiple options, and according to stage we are supposed to use it. Now, single drug property which cure the Kushtha, that is also here listed. Charakacharya has mentioned Khadira, Rasanjana, Saptaparna, Tinisha, Ashwamar, etc. Sushruta, Khadir, and Bijaka. Bijak is Vijaysa, which is very famous to treat Madhumeha. Then Vagbhatacharya has mentioned Kakamachi, Lashun, Haritaki, Nimba, Haridra, Daro, Haridra, Bauchi, Chitra, Guruchi. Bhav Prakash has mentioned about the Manjishtha, Bhallatak, Sthavneya, Rakta, Arka, Gunja. Now, the next thing is again a very interesting thing. What is that thing? That the animal origin, some things are described. Now see, what is something animal origin is used. Such like now when we will discuss, you can understand. Charakacharya has explained application of paste made from blood of a boar or teeth of a dog, cow, horse, camel, etc. Now, PETA is there, so I will not talk about more things about these things. But as a scholar of Ayurveda, we should at least read and think how it can be useful for these diseases, or in the skin disease, how we can use. Okay, so this is a one more interesting thing I have found while I was learning or studying about the skin diseases from Ayurveda. Sushruta has specially mentioned using curd of a camel is a causative for this external application. Okay, uh, external application, not sorry for portion means internal. Okay, so curd of camel is prescribed for the skin disease. Now in Rajasthan, this can be practiced easily. Okay, but they don't know. Okay, so we should, when our friends or one of you will practice in Rajasthan, where the curd of camel is also available, he can use for it to treat the skin disease. Then Ashtanga Sangra has explained urine of cow, goat, buffalo, elephant, that we know. And we have seen that the Mutra Varga. Ashtanga Hridaya, that again the same Mutra Varga is described. Now see here, we have to focus on the same slide, same thing, that what is the contribution of other scholars than Charan. That is the contribution of in the skin disease treatment. That is the Langhana. That is the slitting or thinning therapy. That Vagbhadacharya has mentioned that diabetes, amadosha, fever, kushtha, these diseases can be treated with Langhana. Okay, definitely. If the skin disease is at just initial stage, then you can advise the Langhana to treat it. Avaleha, that is the confections, liqueurs. Sushrutacharya has explained empty stomach in the morning with honey. A recipe is described. Now, this is the specialty of Sushruta. Vagbhadacharya has a mixture of powders should be taken with ghee and honey. Okay, so these are the some contribution of other things. Ayaskriti, we know that the ayas means loha with some other recipes such as ayaskriti to lick with ghee and honey. Vagbhadacharya has explained Krishna loha, ayaskriti. Bhav Prakash has explained about loha and marita loha. These kind of lickables can be used. Ayaskriti. Ayaskriti, see in Brihatri, we found very less internal medication references, and this is one of it. Madhu, that is honey, can be with Audalaka Madhu. Now, what is Audalaka Madhu? Suhrutacharya has recommended it for skin disease. Vankatacharya also mentioned for Madhu. We know that Taila, Grita, Madhu, these are the Paramaushad, and Madhu is for Kaphas. So, definitely for vitiation of Kapha or more predominant Kapha stage can be used with honey. The next is Bhava Prakash. Is again he had combined the both Avdalaka Madhu and Madhu. Now Rasayan Prayog, that is rejuvenation therapy. Vagbhat has asked about Rasayan to avoid the relapse. Especially Vagbhadacharya has explained Rasayan Prayog. Daiva Vipashray Chikitsa. So one may not like, but as a scholar, we should learn, that is activities to please benevolent gods and ward off malevolent spirits. So Sushruta has explained about resorts to Pinex, then Ashtanga Sangra, toxins and mantras, then Ashtanga Hridaya to the anti-poisonous hymns, worship of Shiva, Ganesha, Tara and Bhaskara to reduce the skin disease. Now Pathyapathya is also important part of Ayurveda. What is Pathyapathya? That is dietary and behavior guidelines. So Charaka has mentioned light and balanced food. One should go for vegetables with bitter taste and food preparations, medicated ghee, old cereals which will not produce clay, the meat of animal especially of jungle area, jungle pradesh, that is arid area. Now should not consume, one should avoid, the skin disease person should avoid heavy and sour food, milk, curd, fish, meat of animals, especially Anupa Pradesh, that is wet area, I should say aquatic animals also, such like fish, jaggery, and this jaggery, that is the Navaguda, not Purana Guda, then Sise. Sushruta and Vagbhata also advocated about Pathya. We have not given here the list. Thank you. Now, see, if you have questions, especially regarding about our today's topic, that is Charaka Nidana, that you can ask now. Charak Nidan by Chikitsa Sutra. If you have questions, please.